Alice is a professor of linguistics at Harvard, a world-renowned university. She enjoys jogging as a hobby. One day she forgets the way home from her daily run. Everything suddenly seems unfamiliar. It was an unfamiliar feeling, like I had landed in a new place. Alice lived a happy life as a mother of 3 siblings, a loving wife, and a respected professor of linguistics. Even though she was still young, she learned that she had early onset Alzheimer's. This is the movie Still Alice. In this way, Alzheimer's is often used as part of content such as movies and novels. Recently, it is said that an increasing number of young people are knocking on clinic doors saying they are worried about their memory loss. It seems that there are surprisingly many people who think that Alzheimer's can commonly occur in young people as well. However, Alzheimer's disease is a degenerative brain disease that mainly occurs in people over 65 years of age. This disease is a process in which brain cells are gradually destroyed. As in Alice's case, only memory impairment appears at first, but spatial perception and judgment gradually decline, and the ability to perform daily activities is lost. So in the end, the patient becomes unable to complete even simple daily tasks without the help of others. Abnormal behaviors such as hallucinations and delusions may appear. The answer to why certain people develop Alzheimer's disease is still unclear. However, it is known that genetic and environmental factors have a combined effect. Drugs approved by the FDA such as donepezil, hydrochloride, rivastigmine, galantamine, and memantine are widely used as official treatments. However, there is still no cure for Alzheimer's. This is a symptomatic treatment and cannot stop or reverse the progression of the disease. But don't worry, the cause of Alzheimer's disease is the accumulation of beta-amyloid protein in the brain. These brain changes appear 10 to 15 years before the first symptoms of the disease begin. This means that the opportunity to prevent disease and delay symptoms is wide open. 1. Dance, do housework and exercise. Through an active life such as regular exercise and housework, we can help improve the brain's cognitive function. Some studies show that exercise helps maintain connections to old cognitive memories. And the act of moving the body stimulates the human brain by creating connections between new cognitive memories, resulting in better spatial memory. High blood pressure in midlife is considered a risk factor for cognitive decline in later life. Heart disease, stroke, and depression also have an impact. Controlling high blood pressure through exercise may also help prevent or delay Alzheimer's disease. One study compared the cognitive abilities of 454 older adults 2 years before their deaths. With an average age of 90, they found that higher levels of physical activity were associated with better cognitive function even after the participants' brain tissue showed signs of Alzheimer's disease. Additionally, there is another study involving 1,159 adults over 65 years of age. The study looked at participants with high levels of tau protein, a hallmark of Alzheimer's. The results showed that people who were more physically active had a slower rate of cognitive decline. 2. Do intellectual activities that keep your brain flexible. Read books and magazines, and play the game. Take or teach a class. Learn a new skill or hobby, and work or volunteer. People who participate in these personally meaningful activities feel happier and healthier. Learning new things can also improve your thinking skills. Enjoy activities that are a little more cognitively complex, such as music, theater, dance, and creative writing. More complex activities like these help improve memory and self-esteem. And it improves the quality of life of older adults, such as reducing stress and increasing social interaction. 3. Go outside, meet people and do activities together. Social isolation and loneliness are bad for your brain health. Loneliness is associated with an increased risk of dementia. Less social activity has been linked to lower cognitive function. People who engage in personally meaningful and productive activities with others tend to live longer, feel better, and have a sense of purpose. So, visit with your family and friends. Volunteer at a local organization or join a group focused on your favorite hobby. Or exercise with someone else. Check out programs offered through local community organizations. Meet and connect with others who share your interests. Do you remember Alice I mentioned earlier? Just as her memories slowly faded away, Alzheimer's robs patients of their precious memories. Like Alice, what would you do if this moment is the last time you could be yourself?